Now, I've been waiting to get to this question from the beginning of the show. I hope I'm not putting you on the spot, and feel free to, take a pass and say, Yitzchok, none of your business, but I'm just going to ask it anyways. I hope it's okay. Thank God in my case, I came in. It was a healthy checkup. He pointed out what needed to be addressed. What happens typically? You're dealing with C-level executives. I mean, was there ever a case where someone walked in and the doctor says, hey, we're going to have to rush you over to the hospital straight from here. You're not going home tonight. I mean, am I allowed to ask you?
Yeah, I mean, as long as I don't provide any detail about the patient, we can go there. So there's like three different types of patients. We end up with a patient that's healthy and everything checks out great with some follow-up. There's patients where there are some borderline issues. Then you have patients with significant issues, and then you have what I call, very significant issues that requires immediate.
And they didn't even realize it when they walked in.
They didn't. Absolutely. Many not. Majority of patients are not walking out, are not coming in, and we're not uncovering, a time bomb in, a high percentage of patients. That doesn't happen.
But it seems that it's happened.
But absolutely, we had a couple of really, fascinating cases. We had a male executive that came in a couple of months ago, 50 to 60-year-old, healthy guy, works out 4 times a week, great shape, traveling to on a family trip tomorrow with the family, and he came in for the exam the day prior. Did a stress test. The stress test was negative, which means no immediate blockage. We do the coronary calcium score based on his cholesterol levels and some other family history. The calcium score was in the 2,000 range, which is basically at the 99.9% level for that age and gender. We have cardiology, like I mentioned before, on site. So we moved him to cardiology. They did a nuclear stress test. He ended up getting a triple bypass the next day.
Wow.
Now this is a healthy guy. They call it the widowmaker. People have heard that term. It's the widowmaker because you don't actually feel any symptoms on that. The guy was, obviously super thankful. He ended up going on his trip a few weeks or a few months later. He sent us cases of wine. He was in Napa Valley.
Wow.
We had a case of that. We had other cases with cardiac too, where it wasn't a bypass the next day, but we had a 37-year-old individual that came in. Not the healthiest individual, but there's no reason in the world to be worried about anything as significant as an actual blockage. Actual blockage. It was a holiday weekend. He ended up getting 3 stents placed that weekend. In the blood work, sometimes we pick up some significant findings that you wouldn't expect. So it's when it happens, it's for the team. It's just such a great. We don't ever want anyone to have any issues, but just being able to help someone in those situations is beyond amazing. So it's been eye-opening.
Is there a particular age that someone should really wrap their head around this and say, I really should start thinking of this full-day physical exam?
So we like telling people, you should be monitoring and watching your health. Our clientele also, it ranges. It's from 30-year-old all the way up to to 60 plus to 70. There's the cost component, so that sometimes skews it a little bit higher. But we at 40 years old, even younger than that, that's when these issues start coming up. One of the things that works very, very well in the model that we have so much data, when you go to the doctor and they tell you to be healthier, because 2% of the population can have a cardiac event, that's nice and not as meaningful compared to when we show you a picture of your arteries and you see the blockage. So that really, so that even if the issue is not significant today, if you're you don't want to be in the 50th percentile at 38 years old. So we tell people ongoing monitoring and being proactive is important. But once people are hitting 40, they start feeling it. They haven't done anything. That's when I think people really start coming.
Ari, let's get back in the few remaining minutes that we have. Elitra Health. Now, again, for people to find out more information, how can they find out?
Website is going to be the best spot, elitrahealth.com, ELITRA, elitrahealth.com.
Now, what are some of the... I don't know if it's a fair question because it's the whole process is so comprehensive, but Do you have any short-term or long-term goals? Like, can I put you
Sure.
on the spot with that?
Yeah, sure. So,
Okay.
I mean, short-term goals, Elitra, it's an offshoot of an existing company brand. A lot of our management team is the same. A lot of the clinical team is the same, but it's still a new brand. So in the short term, my primary focus, historically for me, I've been very heavily involved in operations, in experience, but my focus has been on growing the brand. Brand awareness is a whole, whole new world, for us in this world. So my short-term focus is really continuing to sell and grow the brand, and we've made phenomenal progress in our first 12 months. And to really push that. So it's the sales, marketing, partnership world for me. We're always looking at the exam itself, what else we can offer, talking to our patients, what will make things even more convenient and even better. There's a ton that we are already doing there. There's not much more we can do, but dental came up as an option. You're there for the day. You're there for 5-6 hours. So those are the type of things that we're looking to improve on the experience. Longer term, we're very confident in our progress, and we want to look for additional regional centers. From a business standpoint, you're selling and marketing. We're in New York City. We get it's a day. We get a lot of people that travel from all over the tri-state. We get people that travel nationally. We have people that travel internationally. A lot of Chinese patients, Russian patients.
Wow.
Yeah, I mean, fascinating. Oman. I mean, the from the places that we, we, as we grow and when we hit capacity, our goal is going to be to look at other regional centers on the East Coast.
And to give them the complete same experience that you have downtown Manhattan.
The complete same experience.
Before I get to my final question, I just have to sneak in another quick question. I mean, you're doing this. It's a business. There's a financial model, but it must feel pretty special. You are enabling people to live longer lives.
I mean, there's no question. For me, and I don't meet every patient. I don't see every patient, but I get it from the staff. They love what they do. I mean, our people love working. They love interacting with the people, and they love being able to provide really a healthcare option. I say, if you ask any doctor, this is the ideal way to deliver medical service. They just can't afford to do it,
Right.
In the insurance world.
Right.
And from the patients, patients too, this is the ideal way to get medical. So the staff absolutely, they love it. They're thrilled, and for me, that's amazing. And secondarily, in the medical world, to provide a customer service at this level for me is just really, really satisfying. We haven't had, our satisfaction rate is literally 100%. A lot of our business is driven through referrals, and people walk away as much as they knew beforehand. Once they go through it,
Right.
they walk away with, I got to share this with people. Like,
Right.
how is this not,
I certainly,
So that's so it's really, it's been great. It's been a great ride.
Ari, the time goes very fast here on the show. Any final thoughts for the listeners of Mind Your Business from your vantage point as COO of Elitra Health?
I mean, I think we hit on it before. People are busy. People, they focus on what's in front of them, and sometimes it's hard to take a step back to be proactive about health. If it's at Elitra or if it's wherever it is, take a step back, assess where you're at, and do it now. Don't wait. We don't want to see people coming in when the issues are happening. So do as best as you can, and as employers, do what you can to just also encourage and promote your people to just be a little more proactive.
I love the honor of interviewing C-level executives and sharing their great advice and perspective on Mind Your Business. I'd love to get your feedback. Post it in the comments below and subscribe. You'll never miss an edition of Mind Your Business.